This is my humble appeal to Government of India with regard to NMC bill advising doctors to prescribe drugs on generic names. Chemical nature of the tablet, the molecule should be prescribed rather than writing a brand name of medicine which is produced by some other pharmaceutical company. This is very nice idea. But I request government, especially Honorable Prime Minister, to look into this matter and advise suitably. Any intervention, if you want to introduce, it should be done gradually, progressively, with a very comfortable guidelines so that people can adhere to very easily. You're telling doctors not to write brand name, write only the name of that particular molecule. For example, paracetamol. Don't write crocin, don't write dolo, or don't write calpol or anything. Yes, you should write only paracetamol. I agree. But when this can happen, firstly, government has to regulate all pharma companies not to print brand names on the tablets. They should write, for example, it's a particular pharma company. If they want to produce a paracetamol tablet, they can write paracetamol tablet, but at the end, produced by so and so company. Obviously, the company which produces, their name will be there definitely. If all the companies produce tablets with their generic names, there is no difficulty for pharmacists and for the doctors. This number one. Number two, who is distributing this medicine? It's a doctor? No. Distribution of medicine from doctor to patient is done by a pharmacist or pharmacy assistant or a medical shop owner, whether it is in a hospital or in a private medical outlet. These people are not all of them well trained. In fact, you find many of them non-matriculates who are distributing the tablet. And a lot of chain of medical shops have come now because it's a very big business. That is very nice. But they all should be trained so that they understand the generic names, not brand names. So first level at the company, second level at the pharmacy level. No pharma shop can be handled by untrained, unqualified person. They should be 100% qualified, or they should have an adequate degree or certification by which they can participate and they can help the patients. Number three is the doctors. Yes, for a doctors it will take some time. For example, if you want to write a B complex capsule which has a 18 to 19 ingredients, if you want to write that whole list, it will be one full page of only one B complex capsule. But if I write one B complex capsule, pharmacist will give a capsule rating from 5 rupees to 50 rupees. So there is no uniformity of pricing in your shop. Who will maintain this? Dear sir, so first level, at the pharma level, they should produce their medicines by the generic name. At the end, the company name can be there. Yes, why not? Secondly, at all pharmacies, person should be well trained and they should have proper certifications and they should have the pricing uniform. Pricing it makes a lot of difference. If you go to a village, this is known as a counter selling. You ask for a drug for 10 rupees, he will give you a drug of 5 rupees because there are companies who produce 5 rupees, 3 rupees also the same tablet. So this disparity should be removed. And finally, yes, doctors do have the responsibility. Doctors should not be hand in glove with the pharma companies, writing their own products, promoting their only one company's product because they got benefited. Yes, it is ethically agreed. Sir, you are a wonderful Prime Minister. You have done a lot of renunciation to our country. You brought a lot of good changes. Kindly my appeal to look into this and don't put doctors in trouble. Already doctors in trouble, except a handful of big surgeons. A lot of doctors don't really make a lot of money. One general physician works from morning till evening to earn 2 lakh rupees a month. People think doctors make a lot of money. No. Yes, big hospitals make a lot of money. That's why hospital by hospital, branch by branch, they're opening. But doctors really don't make big money. Even the government jobs, industries, only recent times they have increased good pay scales. Otherwise, doctors were always sufferers. So, have an empathetic approach towards medical fraternity. Develop guidelines slowly over the period of time. Don't scare them, we'll penalize, we'll cancel license. It is not a constitutional way of threatening doctors. It's my request and appeal, sir. Please kindly, with a magnanimous heart, look into this issue and sort this issue out. We all agree with your idea, but not agreeing with the speed at which it is pushed into our practice. Thank you very much. I hope our colleagues also agree with me.